Maddie.
Hey, how are you?
Good, how are you?
I am great.
Amazing. Thank you so much for coming on the Whole Lotta Healthcare podcast. This is our first show, so I am super excited and we're just going to see how this goes.
Absolutely. Let's do it.
Okay, awesome. So, to start off, a little introduction. Maddie is a registered nurse. She graduated last December, and I wouldn't really say that you are a new grad nurse now, but how are you feeling?
It depends on the day, honestly. Some days I'm like, yeah, I got this. And then other days I'm like, I should go back to nursing school probably.
I feel completely the same way. I
Yeah.
just finished my program, my equivalent to a BSN, in August, and I am still like reading the textbooks, going
It's
back through stuff.
it's a whirlwind, but from what I hear, even from nurses who've been in the industry for years, are like, I still learn new things every day. And
Exactly, right. So, what are you doing right now with your RN degree?
right now, I am a home health nurse and technically case manager. So I go and I see patients in their homes, or we do a lot of assisted living facilities. We kind of do anything that the doctors order us to do. So anything from wound care to catheters to just checking on people, education, kind of do everything. So it's been really interesting as a new nurse because you have to learn all your skills, but then also just have to know what you're talking about and learn all these new things along the way. But it's unique in the fact that you are independent. Nobody is watching you like you're in
Yeah,
a hospital or anything like that. So you really are just like learning as you go.
right. Do you feel a lot of support from your company?
Absolutely. If there's ever been a skill that is like a little bit risky or, just something I'm not comfortable with, they'll meet me out there and show me how to do it or, send me
That's amazing.
resources and everything. And it's been great.
Okay. And I'm sure too that the patients you're seeing, are these patients that, you're going every week and seeing them, or is it like once a time and then they're done?
Yeah, most of them are on a weekly basis. If we get to the point if we're seeing less than that, then they don't really have what we call like a strong skilled need. So we do a lot of wound care. So if people have wounds from surgeries or an injury or anything like that, we'll go in and just clean it, bandage it, put certain medications on it, that sort of thing. But most of them require at least once a week, sometimes even 2 or 3 times a week right now.
Okay. And I'm sure it varies with each patient that you're seeing, but on average, how long do you think you spend with each patient?
Yeah, it definitely varies, especially with insurance, Medicare
Mm,
requirements. We used to be able to have them in for months and months. I had patients for like 6 months, and now they're trying to keep it under 2 months.
okay. And then how many patients do you think you see a day?
It definitely varies. I would say on average, like 5 to 6 patients a day, but we have different kinds of charts that we have to do based on how long they've been on services with us. So if you have a bigger chart, then you usually see less patients.
Okay. And each patient you spend an hour with a day?
I would say if a basic visit is about 20 minutes. If they have
Okay.
extended wound care or, catheters or that sort of thing, it can take 45 minutes, but on
Okay.
average, kind of somewhere in that window.
I feel like one of the great things about being a nurse in home health is that you have flexibility in your schedule. Can you tell us a little
Yeah.
bit more about what your schedule looks like?
Absolutely. My schedule, so I only work Monday through Thursday, so I don't work weekends. We're on call every 2 to 3 months, which is really nice, just one time, so it's very minimal.
Okay.
And you can kind of choose your schedule. So what they do is they release a patient list to you for the week, and you're responsible for organizing them, for calling them and scheduling the appointment. So what I personally do is group people by zip code so that I'm not running all
So
over the
smart.
place. Yeah, and it took a while to learn, but I typically, depending on how many patients I have, I start around 9 a.m. seeing patients, normally end about 1-ish, and then I just get to chart from home, which is like the biggest perk there is. So
That's amazing. Do you have coworkers that you talk to? I know there's probably other people in your organization, but how does that work?
yeah, one girl I actually graduated nursing school with, so we are in touch like all the time, which has been super nice because we understand we're in the same boat. We're new nurses in a whole new world and in a very
Definitely.
specific job. And so she and I talk very often, rely on each other. And then every Tuesday we get together we do home health as like kind of a big picture. So we also have physical therapists, we have occupational therapists, speech therapists,
Wow.
and the case management part of it. We all come together and we say, hey, this patient has this going on. What can we do about it? And so we meet once a week with everybody. So yeah, it's really great. And it's nice because then you're not just alone in your car all day with no
Right.
coworkers. So it's nice to have
Exactly.
some workplace friends and whatnot.
Definitely. And I like the aspect of truly holistic healthcare and you're caring for the patient, the whole aspect of the patient, not just, okay, I'm going to go in and I'm going to clean their Foley and do their wound care, but also thinking, oh, I'm going to be talking to their physical therapist on Tuesday. I can make sure that they know XYZ about this patient.
Yeah, absolutely. That's such a huge part of case management and speaking with their primary physician and just kind of everybody. I mean, I'm on the phone all the time because we're just all trying to make sure we're on the same page so that we have the best outcome for the patient. Yeah.
And earlier you brought up a point that the job you're in is so specific. Did you know coming out of nursing school that this is what you wanted to do?
No, I graduated nursing school thinking that I wanted to work with babies because I love babies and they're so cute. And I actually did have a job in the NICU lined up. And a couple of days before I was supposed to start, it kind of fell through. So I, of course, started to panic. And this job,
Yes.
I hopped on Indeed, and this job just kind of popped up. And I was like, well, I have no idea what it's about, but I'm going to apply because I'm desperate at this point. And I went in and had an interview with my now manager and a couple other people in the company. And I really liked them. I liked they pitched a lot about the flexibility, which is great. Yeah, I was not expecting to go into it, and especially working with the geriatric population. I loved them, but that was not my initial what I was drawn to.
Complete opposites from
Literally from
pediatrics.
one life end to the next. It's definitely been, there's days where I'm like, okay, I miss my babies, and then there's days where I'm like, okay, this is so rewarding. And I think hard part and rewarding part about working with geriatrics is a lot of them are super lonely. So they like treasure you so much, even just having a conversation with them. And it's just the cutest like population to work with. I never thought that would
Oh,
be my career, but I'm loving it so far.
what an amazing experience.
Yeah, it's crazy how everything falls into place.
Right? And I think that's one of the beautiful things about nursing is there's so many different career pathways you can go. Like you said, you thought you were going one way and then the next day you're going a different way. And we're just so blessed to have the opportunity where we're able to do that.
Absolutely. I had a job for a little while in nursing school. I was a nurse apprentice for nurse injectors, so doing like Botox and lip filler and that sort of
Oh,
thing. So I've
awesome.
seen all different sorts. And then actually when I graduated, I was a nurse injector for a little while, but was a little overwhelmed with the whole new nurse things. I took a break from that so I could focus on this home health job. So really seeing from the people who are in complete medical need to people who are electing to have medical procedures, and it's crazy, and they both have great and bad things to both of them, but it's really interesting to have been able to be a part of both.
Can you tell us a little bit about how your experience was in nursing school?
It was interesting. I got accepted into nursing school right when COVID hit. So I had to do the first 2 semesters out of 5 semesters of nursing school online. And
Wow.
those are the semesters where you're learning your skills. You're learning how to put in an IV. You're learning how to put in a catheter. You're learning how to give injections. Like, it's a pretty crucial part of your nursing career. And we weren't able to be in person doing that. So the first day of nursing school, we had to go drive in a drive-through line and pick up an enormous bag of medical supplies. And then we take it home and they'd be labeled by week, and you'd take it out and be like, week 1, IV kits. And then we'd watch a video. We'd get to practice it, but not like IVs. We couldn't really practice those. And then we'd have to go in person. We'd get 1 try before we were checked off on it. And then if you failed it, you had to go and do all these other things. So that was definitely a big challenge of nursing school for me.
And nerve-wracking.
So nerve-wracking. In that aspect of learning skills, it's kind of, you have to act. And they're like, you need to be more realistic when you're talking to them. I'm like, it's a piece of plastic. I can't get more realistic than this.
I feel like that's a struggle that all nursing students have. I remember being in nursing school and doing simulations, and after walking out being like, I am so awkward. Like
Yeah.
it made me a little bit almost more nervous for that patient encounter with a real patient because I was
Oh,
like,
yeah.
when I was practicing it, it didn't feel great. But then you
No.
get into the hospital when you're in your clinicals and it just everything makes sense and everything clicks.
Totally. Yeah, it's way different practicing on a mannequin versus a real patient. And that was just, I think that was the hard part of nursing school for me. But it was also really cool because then all of my classmates, we were all super close. We would all still meet up during quarantine and do all the things that you're supposed to do in terms of social distancing. But
Of
we were still
course.
very like supportive of each other. And it was really great. I think it brought us closer for that reason.
If you could go back and do one thing differently in your nursing career, what do you think it would be?
When I was a student, one thing I would do differently is not sweat the small stuff. I was so hyper fixated on like when you get into nursing school and you're with nursing students, they're a different breed. You know, they study before class and then after class they have study groups. And I was never that kind of student. I have always been the kind of student that just I do what the professor expects of you and that's it. And it was really hard to be like, am I doing something wrong? Am I not doing enough? Am I going to be a horrible nurse because I'm not studying as long as this person is? And grades, like, I'm not saying go flunk all your tests, but you don't have to have on every exam to be a good nurse. The most important thing is that you retain the information that you learn and that you have good clinical judgment in the real world. So the book stuff only takes you so far. Then you have to use what you have in your head and just be able to decipher like, okay, should I do this or this? Because when you're in real life situations like that, you can't crack open a textbook. And as a new nurse, definitely having more confidence because we know a lot more than we think we do. I see it all the time with a patient. They'll be like, hey, I just got diagnosed with this disease. What do you know about it? And I say this big spiel about it. And then I literally like will be like, where did that come from? I didn't even know I knew all these things. And it's like, yeah, you do know these things. Be confident. Like, trust yourself because how is anybody else supposed to trust you if you can't trust yourself?
Yeah, it's almost like imposter syndrome.
Am I actually a nurse? Like, am I really supposed to be here? And you are. Like,
Yes.
you got into nursing school, you went through nursing school, you graduated, you took your exam, like you are valid. You know, that's like the
When
biggest thing that I've had to tell myself.
When I agree with you completely that it doesn't matter what grades you got in the class. It matters about do you know the content where you can apply it in the real world? Because no one's going to
Absolutely.
be asking you, oh, what was your grade point average in nursing school? They're going to be asking
Exactly.
you those hard questions of like, what is this disease? How do I treat this? Like, what do I do?
Absolutely. And I think also just knowing that things do happen for a reason and they might not be according to your plan, but you just have to be flexible and have a good attitude and go with it. You know, there were times I got waitlisted the first time I got into nursing school, but turns out that was a blessing in disguise because then I would have been on the front lines during COVID as a new grad nurse.
Yeah.
My job at the hospital, that didn't happen. You know, I didn't get the clinical placement I wanted for one semester. And it's like, it's these things that you plan perfectly in your head and you say, oh, I have to have this, but it's not going to happen that way always. And sometimes it's for the better.
Was there ever a moment when you were like, I want to be a nurse?
Yeah, it started high school. I took an anatomy class and kind of just fell in love with science and the human body just fascinated me. And I was like, okay, maybe I'll do something in this field. And everybody was saying like, oh, just do psychology, you know, do general if you don't know what you're wanting to do. And then I was speaking with a different nurse and before I even really was considering nursing and she was telling me about her day-to-day experiences and her schedule. She was not a bedside nurse and how much she loved her job and then kind of just got curious and researched and here I am.
That's really the story behind why I wanted to start Whole Lotta Healthcare too, is because I remember as someone wanting to become a nurse practitioner, I didn't have any resources or know anyone who was a nurse practitioner that I could talk to. So I relied a lot on doing research and wishing that I could just have this conversation with that person so that I could get a little glimpse of what they do day to day and what they like and what they don't like about their job. so that I can make an
Absolutely.
informed decision.
You can look up on Google and be like, what does a nurse do? But the truth is, it's so different. And, day to day, every day is so different. And I would say a huge thing is if it is something you're considering or there's a certain specialty you're considering, just go and see if you can shadow people. Shadowing people is such a huge gift. Half of choosing what you want to do is also figuring out, I don't want to do that.
Yes, exactly. Like you said, putting yourself out there, asking who you do know if you can shadow them or if they know someone who you could shadow is so important because you don't want to spend all this time and, years in college to do something, not necessarily even nursing, but to do something and then get in that role and realize that it's not really what you want to do.
Right, absolutely. And even then in nursing school, like I would just get overwhelmed and be like, do I even want to be a nurse? And there's still days where I'm like, why am I a nurse? And then you have those days that you're like, this is why I'm a nurse. And this is why I went through
Yes.
all that hard work because it's, no matter what job you take, there's going to be parts that you don't like about it, but it's how rewarding being a nurse is outweighs all of the negatives for me.
Can you think of anything else that you think people would benefit from knowing?
I think an important one is knowing that you don't have to go to bedside right out of nursing school to be a nurse. That's something that I struggled with because all of my friends and majority of my classmates had bedside nursing jobs. And I was like, oh, am I doing something wrong? And you don't have to be a bedside nurse to gain experience or be a good nurse. And so just to know that there are other avenues and bedside isn't your only option as a nurse.
And jumping off of that too, I feel like there's a stigma that when you are a new grad, you have to start on general med surg, and that is not the case at all.
No, that's one thing that I've learned is you don't have to fit the mold that people have created. Nursing is so unique in the fact, and that's one of the beauties of nursing. There are so many avenues. There's so many ways to be a nurse. You don't even have to be a practicing nurse. You can be a telehealth nurse. You could be a case
Educator.
manager online. You can be an educator. You don't have to be practicing active skills to be a nurse. And I think that's super important to highlight too.
I think that's the other advice to people who are in nursing school is it's okay if you don't get it the first time. I think it took me 4 or 5 times trying to put an IV in before I actually got it.
Yeah, and there's still nurses who I have seen who've been nurses for 20 years and they still miss a vein every now and then. We're not robots, we're not perfect. We make mistakes, but hopefully not too big of ones. But,
Exactly.
It's about learning from those mistakes and you're never going to stop making mistakes. So you might as well just have a good attitude about it and learn from it and try to not let it happen again.
Exactly. And I don't know how your clinical experience was, but mine, I didn't feel like the nurses, like they put up a lot of pressure on us or they were rude or they were mean because we were students. I had a good experience. And I know this isn't the case for everyone, but my clinical experience was relatively positive.
Yeah, I think mine overall was pretty positive. I think there was like one nurse that I had that was just like I was slowing her down, so it was a pain, which I get, like it does slow you down, so I understand. But yeah, overall I had a great experience. And then my labor and delivery rotation, I met this one nurse and we just instantly clicked, and she became the biggest mentor in my life in terms of nursing and even outside of nursing. They just had a baby and I went to her baby shower, and it's about those relationships that you make, because she completely changed my nursing career in terms of teaching me what's important, teaching me that it's okay to not be perfect, to stand up for myself. It's a huge one that you have to learn as a nurse. And long story short, mentors are such a huge thing to take advantage of as a new grad, as a student nurse, as even just shadowing somebody, because they can really teach you a lot and kind of guide you in the way that if you like their style that they learned and that they were taught, and then you can be that mentor one day.
Thank you everybody for listening. If you would like some more information about becoming a registered nurse, you can go on to my Instagram or my website, Whole Lotta Healthcare. And Maddie, thank you again for joining us.
Of course, thank you.
Whole Lotta Healthcare is a career counseling company dedicated to providing information about jobs in healthcare. If there's a career you're specifically interested in learning more about or hearing from a practicing professional, please send us an email. As always, thanks for listening.